they don't think of that when they're using cocaine, but the street myth is, well, it's not a myth. I mean, it works. If you use cocaine, you can, you know, you can have this baby sooner. It works a lot of times. If you use enough of it, you use it the right way, you can have the baby faster. And of course, if you've only been pregnant 7 months, then we have a premature baby with low birth weight and all kinds of problems at the cost of anywhere from $1,000 to $2,000 a day in the neonatal intensive care unit. That's a problem. That's a real big problem with cocaine, is that the myth. The abruptions that occur, they're finding, even though a woman may quit using cocaine after her first trimester of pregnancy and doesn't do it again, whether she's used it all through the pregnancy or through the first trimester of pregnancy, the percentage of placental abruptions remains about the same. So what happens perhaps is that there's some small tearing of the vessels of the placenta away, and you know, there's just all kinds of problems like that happen. It's overwhelming, and you see it more and more.
Very good. Ms. Fowler, in terms of services that are provided, who actually pay for the persons who might come seeking the services of Meharry's drug addiction programs?
Okay. Again, that's done through a number of ways, and it depends on the individual. One way is through self-pay, and our fees are based on a sliding fee scale. And that'd be according to one's income. If one has little money or no money, then the fees are at a minimum fee. If they have money, then the more money they have, then the more the cost is. But what we try to do is we try to service anybody who needs help.
So even if they cannot afford anything, the service can still be available to them. Is that?
Well, yeah, they're charged the minimum fee, which is real small.
Okay, Mr. Starr, you also mentioned the fact that you helped to create an organization dealing primarily with this as a problem. Why don't you give us some information about that organization?
It's called CITCAP, which is the Coalition for the Identification and Treatment of Chemical Abuse in Pregnancy. Actually, at Vanderbilt about 2.5 years ago or so, 3 of us, Marilyn Smith, who's a social worker, and Lisa Mandeville, who is she is an administrative coordinator in the Department of Maternal Fetal Medicine, and myself got together and realized that we had a real problem at Vanderbilt with finding out about these women, these pregnant women who were having a problem with drugs and alcohol, and identifying them and getting them help. And so we started a little committee there at the hospital, and it was in the hospital at the time. And then we realized that we really didn't know what was happening in the rest of the community. We didn't know anything or very much about Meharry's ASAP program, which Dorothy Pifus works in, and she's a member of our organization. And you know, there are a lot of, and Jan Malem, who is with Dee Dee Wallace, the Phoenix Center. And we have a lot of folks now, Susan Warner with the Department of Health, that we've kind of, what do you call it, networked to create this organization. We've made it community-wide so that we know a little bit about what's going on in the community in relation to services for chemically dependent pregnant women. And it makes it great because we have different accesses for different folks and different needs. And we're trying to educate as well healthcare professionals about the problem of chemical abuse and addiction in pregnancy. Trying to get some public awareness, some prevention. That's actually what we organized for, was for education, screening, public awareness, and to find ways to treat these women. So so far we've done really well, I think, and we've already had last year about this time we had a day-long conference that we had about 140 participants, and you know, we're doing a lot of things in the community. I hope we keep growing and get more members involved from different areas of healthcare that work with pregnant women who are chemically dependent.
Very good. Ms. Fowler, there's also an organization at Meharry that is involved with network, and that's the COPE organization, C-O-P-E, is it not?
Right. it's a prevention program. It's community organization, prevention and education, and basically Project Hope focuses on people who are high risk of contracting the AIDS virus. And what they do is they go out into the community to different churches and other organizations just to educate the people about the disease. They also talk to substance abusers, and they talk to them about being at risk, and they encourage them to get involved in treatment. If they can't get them involved in treatment, they try to give them information on how to clean their needles and just to be a little safer. We get a lot of referrals from the program, and it's working really well.
You think so? You think the organization is doing a good job in the community?
I think it is. I think they're getting the message out, and that's the most important thing, is to get the message out.
Julie, we've got about 5 minutes, and let's talk about education. As a matter of fact, I think that all would agree that one of the best ways to deal with this whole question of substance abuse will be through the area of education. What do you think, Ms. Starr, in reference to education as a method of trying to reach those who might abuse substances?
I think it probably, you know, I'm not an expert on education by any means, but I think education probably works better than anything. I know when patients come into treatment, even those who are most resistant and don't want to be there, they're referred there by the courts, or, you know, the wife says, if you don't get treatment, I'm leaving you and I'm taking the kids, whatever. And it's like, you know, they don't want to be there. They don't think they have a problem. What seems to work best is education, is sitting them down, showing them films, giving them lectures, talking about the fact that this is a disease. You know, you're not to blame that you have the disease, but now that you have it, you're responsible for treating it, and let's do something about it. Treating it that way and taking the shame and the guilt out of it works a lot better than telling people you should know better, or you know, if you just got right with God or had more willpower, you wouldn't have a problem, which we know is totally ridiculous. So I think education is probably the primary way we're going to get people to understand. I hope.
Well, both of you have mentioned shame and guilt associated with the abuse of substance. It seems to me to be a very, very important component of substance abuse. What do you find, Ms. Fowler, in reference to that as a real problem? Is that a real concern? People who are affected, does that keep them from coming in and dealing with it as a question, or what?
For a lot of people, it is a problem, and that's, you know, one reason that they may use not to come into treatment. A lot of times one thing that you know is when you use a mind-altering chemical, that your emotions overtake your intellect and you don't think logically. So you're at a position where you're doing things that you wouldn't normally do under normal logical circumstances. And then once you come down from the high, then you realize that you may have, you know, for females maybe had been prostituting, or you stole something from your mother, or, you know, a number of, you know, beat your wife or beat your husband, a number of things, a number of issues like that. And it's real hard to look at and focus on and to deal with. Another shame and guilt issue is just family members having to look at somebody wanting to be in treatment, because like Karen said, so many people think, well, if you had the willpower, you could do it. If you loved your child, you wouldn't be doing these things. And so they have to look at it from a lot of different areas, and it's easier not to deal with it and not to look at it than to have to go through the hurt and the pain that they have to go through when they're in recovery.
Very good. We've got 1 minute. Karen, is there anything else that you'd like to talk about in reference to addiction and about the program at Vanderbilt University?
I think what Darlene was talking about earlier, and we didn't talk about very much, that I think is really important, is that when someone goes in for treatment of alcoholism or drug addiction, it's really important that we get the families involved. And we didn't have time to talk about that very much, but families get sick too with the person who is addicted as well, because we enable a lot of times, we protect, we don't see, we're sometimes in as much denial as the person who has the addiction. And it's really important that the family members get some education, learn how to deal with that person differently, so that when they are through treatment and they're doing their aftercare, that they don't somehow hook back into that process of using again. And it's easy to have happen. So I think that that's the thing I would like to emphasize, not just at Vanderbilt, but I think we do that. Both of the programs do that. It's involve the families as much as we can, and very heavily in the treatment process and in recovery.
Very good. Let me thank the two of you for coming by and giving us that very, very important information today. And again, let me encourage you to tune in again next week for another informative edition of Comments.